There's been a lot of talk recently about opiates, but there's another substance that we might not need to forget about, and that's exactly what we're talking about with our coastal expert from Horizon Behavioral Health. Clinical psychologist Dr. Timothy Curran joins us now. Hi, Dr. Curran. It's great to see you again.
It's good to see you as well.
So, as I've said, it seems like you can't turn on a news program without hearing a lot about opiates. But now let's talk about alcohol, because there seems to be less focus on alcohol these days. Is it still a significant problem in our country?
Oh, it is. In 2015, because statistics take a little while to catch up, approximately 15 million people in the United States met criteria for a substance use disorder. It carries with it a lot of social problems, health problems, employment problems. In 2010, it cost Americans approximately $250 billion.
$250 billion?
That's correct.
Wow, that's a lot of money.
Yeah.
So, but I know that there are some beneficial uses for alcohol. Can you talk about that?
The Harvard Medical School talks about, there being a very precipitous balance with being beneficial as opposed to being harmful. It's because alcohol can be both a tonic and a poison at the same time. Some of the health benefits, they talked about having 1 drink a day, at most 2 drinks a day for a male, and 1 drink a day for a female can have potential benefits for cardiovascular issues, circulatory issues, can prevent gallstones, and can also be somewhat beneficial for type 2 diabetes. The problem with that is there's a lot of different risks that are associated with alcohol use as well.
Well, and that was going to be my next question, because, we've heard about the benefits of drinking red wine, of course, limited use. But what are some of the risks in overabuse of alcohol?
Well, overabuse of alcohol can lead to, problems with the liver. It can lead to, problems with employment. It can lead to there's also other health risks benefits. If there's any history of addiction, there runs the potential for, alcoholism. And also with women, there's a higher association with breast cancer.
And of course, as I said earlier, we know that opiates have been in the news a lot lately. But we don't want to forget that alcohol is a drug.
Oh, yeah.
Alcohol is a drug. How do you know if you actually have a problem? Because it seems like some people drink every single day and can consume a lot.
Yeah. Well, there can be a lot of different signs that can indicate that it's becoming a problem. If you've tried to cut down or stop and have not been able to do so, if there's been an increased tolerance of needing to drink more to achieve the same effect. Also any kind of withdrawal symptoms, shaking, sweating, feeling, a general sense of unease. Also things like blackouts or, problems occurring with, at home or, legal problems or things of that nature. Those are some of the things that, need to be mindful of, that, maybe alcohol consumption is becoming more problematic.
And at Horizon Behavioral Health, I mean, you guys are the experts and you work with a lot of patients who deal with this kind of thing. What should someone do if they themselves are experiencing, or they think that they may have a problem, or maybe a family member or a loved one or a friend? What would you suggest they do?
Well, there are a number of things. One, if recognizing it within yourself and you have a genuine question whether or not it's becoming problematic. Come in and talk to somebody. Come in and have an evaluation. Come and, if anything, find out for yourself whether or not, there is an issue that needs to be addressed.
A lot of viewers watching right now, and it seems like when you're talking about things like alcoholism or drug abuse or mental health, a person may be a little fearful of picking up the phone and dialing the number because they don't know what the process is going to be, or they're scared to share that secret. What happens when they call Horizon Behavioral Health?
Just sitting down and talking and finding out what's going on. And being able to get a better assessment of, everything that's been happening and, making a determination from there.
But bottom line, there is help available, and it definitely will be beneficial to get that help because it is here.
Oh, yeah.
Well, thank you, Dr. Curran. It's always great to see you. Thank you so much for joining us once again and providing us with the information that you did.
My pleasure.
If you'd like more information on Horizon Behavioral Health or any of our coastal experts, just go to our Coastal Experts page. You'll find that on WSAV.com.